Hi, everybody. Thank you for joining us this week for our latest episode of This Week in Global Health. I am Chris Ronson, coming to you from Kyiv, Ukraine. Almost forgot where I was. And I'm joined by two other members of our TWiGH team. I'll let them introduce themselves.
Hi, I'm Catherine Dunlop. I'm coming to you from Geneva, Switzerland.
Hi, I'm Sarah Akhtar, and I'm coming to you from London.
Okay. Thrilled to have these two on the panel with me tonight as we discuss a very important topic, the World Health Organization reform. Now, WHO reform is a topic that we've been discussing for years, actually. What is planned and why it is so important now is something that we're going to go into a little more detail about tonight. This week's episode is going to break down some of the key aspects of the new program and what we can expect to see happening over the next 12 months. Now, many people became more aware of the fact that the reform was going to take place after the Ebola crisis in West Africa, which sparked intense scrutiny of the WHO's work in emergencies. For a little more detail on that, I'm going to turn it over to Sarah.
Thanks, Chris. As you said, the WHO's response to the Ebola epidemic was widely criticized, and criticism contained, but was not limited to, remarks about how slow the WHO was to react, how surveillance of the virus was limited on their part, and how inefficient administrative policies led to a lack of implementation of actions that could have curbed the spread of the disease. So what became clear after the Ebola crisis was that the broader architecture of emergency response within the WHO needed to be reformed.
Now, as a result of this, things really started falling into place. So I'm going to ask Catherine to briefly walk us through the resulting timeline.
Yeah, so thanks, Chris. General WHO reform has been going on since 2010, actually, but last year member states called for complete reform of WHO's emergency work on top of this. So in January, the WHO hosted the 138th Executive Board, where member states come together and discuss a range of issues to do with WHO's work. And one of the first topics to be discussed was the high-level design for WHO's new health emergency program.
And you've both sort of come upon a very important point, really the same point, phrased differently. Sarah, you mentioned the broader architecture of the emergency response within the WHO, and Catherine, you just mentioned the design of the health emergency program. So our first big question tonight is going to be, what is going to be different about the World Health Organization's emergency response, and what is the structure of this new program? Sarah, I'm going to start with you.
Well, the focus of the emergency reform is to integrate and consolidate WHO's work in emergencies across all three levels of the organization. So that's the headquarters, the regional offices, and country offices. The program's design is based not only what the WHO thinks will work, but on the opinion on many independent experts whose thoughts have been published in reports from various panels and review boards, the links to which you can find in our show notes.
Thanks, Sarah. And the mission of the new program is actually to help member states build their capacity to manage health emergency risks. And when these capacities are overwhelmed, to lead and coordinate an international health response to contain the outbreaks and to provide effective relief and recovery to affected populations. So the main difference is that WHO will be taking on an operational role in addition to its traditional role of standard setting and providing technical advice. WHO's principal role will be to work in partnership with others to facilitate and ensure compliance with critical operational requirements and filling of gaps.
And this again is key. So we now know what they're aiming to accomplish through these changes. Another important question that everyone's going to be asking themselves is, how do they plan to do that? And what does it all really mean? Once again, Sarah.
Thanks, Chris. Well, on the 30th of January, the WHO declared their intention to develop the One Programme. That's one workforce, one budget, one clear line of authority, and one set of rules and processes. This separate body should, in theory, give individuals and the organization more autonomy and subsequently more speed and flexibility during the response. The new WHO program will have the few major following elements: preparedness and technical assistance, emergency operations centers, partnerships and external relations, and management administration.
So when we're talking about these new areas, it's important to remember that WHO's mandate has historically extended to providing technical expertise, guidance, and support, not necessarily mobilizing during outbreaks and emergencies. So the inclusion of preparedness and technical assistance in the new program illustrates how WHO aims to continue with this expert guidance and supporting member states, but the addition of emergency operations capacity, which would be supported by strong operational functions like logistics, is where we really see WHO evolving. But breaking it down, we still don't really know what this is going to look like and what it means in reality.
Okay, so far we've tackled the why, the what, and a little bit of the how. We've actually got a second how. How much will it cost and who is going to pay is always a very important question, especially when it comes to international health or development of any kind. In 2016, approximately $60 million will be required, plus any additional resources or expenses that will be accumulated from additional risks or outbreaks that happen during this period. An additional $100 million is anticipated as the budget for 2017. Now, keep in mind the WHO's budget is about $4 billion annually, US dollars, with about 20% of that coming from assessed contributions. An assessed contribution is basically an annual contribution from each member state, and that contribution is sort of calculated or based on their wealth, population, GDP, things along those lines. There have also, and it's important to note, been calls from a number of independent reviews and panels, which we've really seen a lot of lately, from member states to increase their assessed contributions to pay for the new program. But where this money is ultimately going to come from, especially when it comes to filling those gaps, is yet to be determined. Next phase, what about oversight? We've got the programmatic side of everything. Now, who's going to make sure this happens? Who's going to make sure it's implemented? And who is going to hold the who accountable?
Well, an independent oversight body will be established by the Director General, Margaret Chan, and will report to the Executive Board. The oversight body is responsible for assessing the WHO's performance in emergency risk management, examining its collective work with member states and partners, and reviewing the adequacy of health emergency financing and resources. This is all yet to be finalized.
And now that we've got all of this laid out in front of us, when can we expect to happen? When can we expect all of this to happen by? For yet another timeline, I'm going to turn it back over to Catherine.
Yeah, it seems to be what I'm doing tonight, timelines. So the design of the new program is already well underway, and the structure, reporting lines, and accountability should be finalized by the end of March. WHO will then begin rolling out the newly designed program by establishing emergency operations centers at HQ and in the 2 regional offices with the largest affected populations. So those are the regional offices in Africa and the Eastern Mediterranean. During this rollout, any new emergencies will be managed using key elements of the new program that have already been established. So full rollout and scale up of WHO's new program will evolve between 2016 and 2021.
The Global Policy Group, which consists of the Director General, Deputy Director General, and 6 other regional directors, is responsible for approving the final structure of the reform. Following on from the Executive Board in January, the GPG said that from March, the Director General will provide regular updates to Member States on transformative changes and on establishing the programme, and will report to the World Health Assembly in May on its functioning.
And this is actually why we wanted to do this episode on WHO reform for you now. It is the middle of March, and as Sarah just mentioned, that's going to be one of the deadlines for when we begin to hear more about this information, and we will be very quickly approaching the World Health Assembly. It's now only about a month and a half away. As these changes start to roll out, we really want to keep you up to speed and updated. We've tried to keep this episode as short and snappy as humanly possible, but we know it's a lot of information and there's still many, many questions left to answer. So what comes next? Well, here at TWiGH, like I just said, we want to keep you up to date with the specifics of this information. One of our other goals is we know that much like legal terminology, sometimes health and development terminology can be its own language, and we want to help you cut through some of that jargon to understand what's really happening and what's really taking place. We also know all too well the devastating impact that emergencies and humanitarian crises can have on not only health, but development, and successful management of health is key to achieving sustainable management. Or I'm sorry. I would just like to note that it's Thursday and it's been a real long week. We want to achieve the Sustainable Development Goals. So we really look forward, yeah. we really do look forward to seeing the WHO evolve as the global leader it is to meet these new challenges and this evolving world in and of itself. So I guess very succinctly, this wraps up this week's episode of TWiGH. I'd like to thank both Catherine and Sarah for joining tonight. On a completely unrelated note, this might be one of the very first TWiGH episodes where we're all within like 2 to 3 hours of each other's time zones. And it's
the time zones are close.
So it's Thursday night here, but Whatever time you're watching, whatever day you're watching, have a great day, a great night. Thank you for joining us this evening, and we're looking forward to covering more of the WHO reform and other important health issues with you in the future.
Bye.
Thanks for watching This Week in Global Health. You've just seen our episode on WHO reform, a process we're going to be following very closely with a series of videos devoted to this topic. Be sure to comment in the comments section below. Let us know your questions, your thoughts, your feedback, and anything else you'd like us to maybe go into a little bit more in depth on. You can also reach us via email, hello@twigh.org, on Twitter @TWiGH and we're all over LinkedIn and Facebook. So keep your eyes open and look for us. Be sure to engage and let us know what you'd like to learn more about next.